Some cancers are 100% preventable. You've heard the phrase, early detection saves life. What if you could find a problem before it becomes a disease? What if you can address that precancerous changes before it becomes cancer? This is our focus today on sound health. We are looking at pre-cancer screening or cancer risk assessment. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Stay tuned. The conversation begins after this break.
The program is a 3-year program and it involves training of health workers, providing mosquito nets and nutrients for malnourished children. We have also supplied equipment to primary health centers, as well as providing media information to the public. We believe that healthy mothers will produce healthy children and our nation will also be healthy.
Malaria is a life-threatening disease caused by the bite of mosquito. The name of the mosquito is female Anopheles mosquito. The good thing about malaria is that it is preventable. And how do you prevent malaria? Number one and most important thing is by environmental sanitation. Make sure that you keep your environment clean. Number two thing is that you make sure that you sleep inside insecticide-treated mosquito nets. And for pregnant women, make sure that you go to the hospitals for antenatal clinic and make sure that you collect a drug that we call SP. This SP, sulfadazine pyrimethamine, prevents malaria, especially during pregnancy. Another thing that we can do is by indoor residual spraying, by making sure that we spray our rooms, our parlor with insecticides. What are the signs and symptoms of malaria? You have fever. And what is fever? Your body temperature will be high. Number two thing that you may notice is that you'll be having headache. You may have chills and rigor. You may have generalized body pains, and you may also have generalized body weakness. Malaria is treatable. Make sure that you go to the hospital as early as possible so that they can make an early diagnosis for you and give you appropriate treatment. Remember, not all fever is malaria until it is proven so.
The program is still Sound Health on Lagos Television. Join us via Zoom this evening to tell us more about cancer risk assessment, especially known as pre-cancer screening, is Dr. Kolawole Afolabi. He is a medical director with Lynx DNA Laboratories Limited and also the medical director at Agon Medical Center. Good evening, Dr. Afolabi, and thanks for joining us.
Good evening.
Precancerous changes happens without no symptoms, showing no symptoms at all. Why is this so?
Yeah, the cancer is a very debilitating and economically devastating disease in the world. It affects both the individual and the family and other relations. And the treatment is usually very expensive, but with poor results when detected very late. So it is therefore important to find ways of either preventing cancers or predicting and screening cancers to detect them early enough to encourage good prognosis and reduce economic implications.
Okay,
so we need to look for ways to find to prevent cancers by health education and do cancer screening to detect early enough because the emergence of cancers.
Okay, if the precancerous stages show no system, how do we prevent it? How do you tell someone is at risk of cancer?
Yeah, there are types. The major causes of cancer really is mutation in the genes of the individual. When there's mutation, the cancer cell, the cells begin to multiply uncontrollably and occupy normal spaces. The abnormal cells begin to occupy normal spaces. That's the genesis of cancer in the individual. But we don't really know what causes the mutation. It can happen. Now, technology has discovered that genetic causes to cancers, and that genetic causes can go from family to family. So for patients with cancer, we advise the relatives to go and screen for cancer to know whether they have the chance of having cancer in the future or not. And that's what we call cancer risk assessment. And we have many ways of doing that these days. We have cancer markers that we look at. We have other markers that we look at the gene base of the individuals to know whether in future they have the chances of having cancer. And once we note that the patient has the possibility of having cancer in the future, we now have the genetic counselors and the doctors to advise the patients on how further to limit the risk or how to limit the consequences of having cancer in the future.
Okay, Dr. Afolabi, many people hear the word screening and all they think about is cancer diagnosis. Tell us, is there a difference between pre-cancer screening and cancer screening?
The pre-cancer screening is a general screening for everybody that they have cancer. There are some cancer markers, there's C125 that will do cervical screening, we do pap smear. Those are pre-cancer screening. Genetic cancer, but cancer diagnosis or cancer screening is for the suspected individuals or predisposed individuals whose family members have suffered from cancer, whether a mother, an aunt, an uncle with prostate cancer. If you have a family relation that has cancer, you intentionally want to go and find out whether you have the chances of having cancer. So that too is still suspicious. But if you are going for cancer diagnostics, it's a different ballgame entirely. That cancer will tell you the type of cancer and type in it. The regional cancer, colonic cancer, prostate cancer, cervical cancer, then you type it. Those are diagnostic tests. The screening is about taking people who are suspected, who suspect, and screen them on general. You do pap smear for them. You do cancer markers for them. Those are general screening cancer. When we are looking at genetic cancer, we do it for predisposed people who want to know whether in future they are likely to have cancer. Because my aunt suffered from breast cancer, I don't want to suffer from breast cancer. My father died of prostate cancer, I don't want to have prostate cancer. So we'll do a genetic screening for them. So that's the difference between the pre-cancer screening and cancer screening itself.
All right, Dr. Afolabi, thank you for that explanation. So when do you recommend screening for such people that are predisposed to cancer or at risk of cancer? At what age would you recommend screening?
Yes, there's no age barrier to screening because we have pediatric cancers, we have cancers in the adults, we have cancers in the old age. But what we tell you whether you need to go for this screening or not is whether you have a relation. If a relation has, like if a father has prostate cancer, there are 50 to 60% of a male child to have prostate cancer in future. So that whether you are 18, you are 20, you are 40, but for general people, for colon, once you are turn to 40, 50, you can begin to go and do colonoscopy to detect whether there's possibility of you having cancer or not. If you are anytime you are over 40, you are due to be screening for one cancer disease or not. Pap smear for papilloma or anything from age 18 for female, they should begin to be looking at doing pap smear. So there are different, but because we have pediatric cancers, which comes with probably from birth or exposure to some toxic substances at birth. So we don't have limitations. Until you turn 40, we don't do something. But like um, mammogram, because of the fact that you are still childbearing and the dangers of going to mammogram machine early enough, once you turn age 40, then you can go and treat for breast cancer through mammogram. But before 40, we don't advise any women to go for mammogram.
All right. Is
So
the
it's a
cancer
complex, not a general blanket
all right? Is the cancer risk
age
assessment?
limit.
Are you with me, Dr. Afolabi?
Very well.
Okay. Is the cancer risk assessment for all types of cancer, and how long does it take to get this test done?
Yeah, it's for now, it has not spread to every kind of cancer, but we have success story in major regional cancers, prostate cancer, breast cancer. You see, we hear it BRCA1, BRCA2, colonic cancer, blood cancers, pancreatic cancers. We have genetic tests that can detect whether you have a risk or not for that now, even in Nigeria. Going forward, it's probably going to spread to all kinds of cancer.
Okay. So how long does this test take? If I'm going for the cancer risk assessment, how long does it take?
Yeah, it's by two periods, two kinds of tests. By the time we start to do local diagnosis frequently, it will take between 2 weeks to 3 weeks. But now, in some cases, I would send our samples outside. It can take 6 weeks to get your results.
For many, the fear of the test is even worse than the diagnosis or the result. Take us through some of these test procedure. For instance, let's start with pap smear. If you taking the pap smear test or the risk assessment for pap smear cervical cancer, take us through the procedure.
Yeah, the fear is it the fear of doing the test or the fear of getting the results. Because there are procedure for pap smear. Pap smear asks nothing, it asks very little. You just do, the specialist will do vaginal, examine the cervix, and think it's a simple chip. It's not that's not difficult at all. If you want to do colonoscopy, they'll prepare you for it. You don't eat for a certain period, maybe 2 or 3 days, they'll give you on lavages to clean the bowels and they scope the colon. So that may take a little bit of complication, but we are not opening anybody up to run any tests. So if you are going to do mammogram, I told you, you enter the mammogram machine, you come out. If you are going to do the genetic one, in fact, that's the simplest. Just collect your saliva and then we'll run the test over a period of 3 weeks and get the result. That one is very, very non-invasive. You collect your saliva, you are going to the prostate, we run the prostate markers. If you are going to check for the colon, we go there. If you are going to check for BRCA1, BRCA2, all are inside that saliva. So it's very simple.
All right. So let us look at some myths and misconceptions now. You mentioned mammogram. The myth or misconception out there is that when you go for mammogram or other tests, you are at risk of other cancer. It predisposes you to cancer. How true is this coming from an expert?
No, there's nothing like that. What you want to find out going through mammogram is to know whether there's a little unseen swelling somewhere and to know whether it's something that can go forward. Is to advise us to what next to do. So, because if you do physical examination, you might not feel anything. Sometimes you feel. When you do breast scan, you might not feel anything. Sometimes you feel. But if there's a growth that is very minute, mammogram will pick it. And that's all. It's mammogram is about radiation. So that's how they say undue exposures. If you do it too frequently, they say it can cause something else. But if you do mammogram once or twice, maybe 1 in 2 years or once in a year, it won't cause anything. People work. We have workers in the industry that their own work is to do mammogram for people. So, and for every procedure, we take a precaution, we take protective devices to protect both the clients, the patients, and the workers from undue external interference with these radiations.
All right, Dr. Afolabi, does a positive screening result mean that you have cancer or you're likely to have
Not,
cancer?
yes, there are three results. If you do a genetic cancer screening, the result at the time you are doing it may be totally negative. That's as at the time you are doing it, there is no, they can't see the future of you having cancer. There are some level they'll get that is indeterminate. And you say, they are saying something, but it doesn't look like cancer in your gene. So you come back in 1 year or 2 years time to repeat. There are some that will say you have 40% chance of having cancer in future, you have 30% of having cancer, but you have 65% risk of having cancer. So, and that's not the end of the whole thing. The idea of doing the screening or getting the genetic cancer test, the risk assessed, is to prepare you for the future. For example, if you are working in the chemical industry and they say you have chance of having lung cancer, and if you are equally smoking, if you are drinking, the counselor, genetic counselors or doctors, as the case may be, will advise you what steps to take to reduce your risk of having the cancer. If you have 60% or 40% of having cancer of the breast, having seen what it has done to your own auntie, or to your mother, to your sister, some people could do radical mastectomy to prevent themselves from having the cancer in life, having seen what it has done to family members and causes. So, that's, in some other cases, they can do abstention from some other things they do, like smoking, like alcohol, to stem down the risk of having the disease. So that the interventions, the counselor and the doctor will advise individual post the test. And if it's indeterminate, we'll ask them to come back at an appropriate time to repeat the test. And for those who don't have at that time, we let them know that it's actually not a rule over that you will never have it. That's at the time we run the test, there are no signs of the risk in you.
All right, so Dr. Afolabi, is this test affordable and accessible? Is it readily available in Nigeria, or we have to seek help abroad before we have the test done?
We have some few centers now that we can get it done in Nigeria. There are about 4 or 5 right now.
I know they say prevention is better than cure.
And,
how affordable is this test?
It's not. I can't talk about affordability in terms of naira because I don't know how much they're testing now. But the fee I know is about from 600,000 to 1.5 million naira.
Oh my. All right. So what are you? 600,000 naira is a whole lot. What are you doing about, as an expert in this field now, you're a stakeholder, what are you doing about advocacy? What are you doing to let people know more about the cancer risk assessment? Because if you are to compare the cost of prevention to treatment, it's still fair.
Yeah. Yes, the thing about advocacy is a major intervention process that we need to carry out. So what we do is to link up with NGOs that are into the field, and they mobilize people to know that they can actually prevent it. And we let the doctors know that there are rooms for relatives of these people that they are treating for the disease, that it is better for them to go for early screening so that we can assess the chances of them having the cancer or the risk of having the cancer or having it in as early as possible. Because the whole idea, like we already said, is prevention. When you don't see the cost of the test from 600 to 1.5 million, sometimes 2 million, sounds very heavy. But compared to peanuts, when you consider the cost of treating the cancer. And when the cancer has gone beyond the local cells and having metastasis in the other region, what treatment is all about is to reduce the devastating effects, the spread, and reduce the pains and prolong the time range the patient will eventually go when it has spread into other regions. That metastasis have gone beyond one local to 2 or 3 other regions, has become systemic. It's become irreversible. It can only be prolonged and reduce the pain while going through the treatments and going to the devastating effect. So, but the cost of early detection there can be sound to be heavy. But when you see what it's going to do to you, in case even detected and then you have it, we can have total, that's 100% prognosis if it's detected early. And you live your life thereafter as if you didn't have any cancer. So, whereas if it has gone beyond one region to throwing metastasis to other parts of the body, the prognosis is very poor. So, but by and large, it's for the people to even know that they have the opportunity of running the risk assessments and getting the diagnosis early. That's why I have advocacy among the NGOs that are into it, and letting the other doctors know becomes very useful. And Lynx itself is collaborating with a number of institutions to ensure that people know about it.
All right, your final words as we wrap up now in 30 seconds, Dr. Afolabi.
My final is to advise people to encourage themselves and their relations to get into early diagnosis of cancer, to limit the devastating effect into by themselves and especially their family, because it actually affects every member of the family. It will reduce you from going to your work and take care of them, even though we know that the prognosis is still very poor. So my one final word, go for early diagnosis, go for cancer risk assessments, and go for cancer screening.
All right. Go for cancer screening, pre-cancer screening, go for cancer risk assessments. The devastating effects of cancer can be reduced if you seize the opportunity to screen during the window period. Dr. Kolawole Afolabi, thank you so much for your time and expertise on pre-cancer screening.
Thank you. God bless you.
You're welcome. I have been speaking with Dr. Kolawole Afolabi, Medical Director, Lynx DNA Laboratories Limited, and the Medical Director at Agor Medical Center on pre-cancer screening, how to reduce the devastating effects of cancer in the society. Sound Health continues with trending health report from around the world. Please stay tuned. program is still Sound Health on Lagos Television, and we have been talking about how to reduce the devastating effects of cancer. Cancer is 100% preventable if addressed or if screened early enough during the window period, especially if you are at risk of cancer. This is why we say thank you on today's episode of Sound Health. If you'd like to get more information about the cancer risk assessment, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.